So because for kidney, it's a different story. For our transplant patients, the average wait time is about 5 years, and depending on when they got listed for transplant. But we don't take patients with really bad hearts or who are really sick, but all your patients are pretty sick to begin with. So who doesn't qualify for heart transplant and they have to live with ventricular assist devices? It's like patients who are not smiling for the doctors or mean to the nurses, or is it some other criteria that disqualifies them from heart transplantation?
No, that's a great question. Generally speaking, there's an age cutoff for heart transplant. It's 70 years usually. If you're above 70, your body may not be able to go through a big surgery like a heart transplantation. They cut open your chest, put you on a device, take the heart out, put a new heart in, and then you have to survive. So age is one. Then amount of sensitization that you may have may also make or break your case. If you have a lot of antibodies, highly sensitized, a lot of centers would be careful doing those because outcomes could be difficult or poor. Some of the basic ones are if you're smoking or you're drinking alcohol, smoking tobacco, doing some sort of drugs, even marijuana in most centers is considered something that may you qualify for a heart transplant. So drug abuse. There are some social issues that sometimes come into play, significant history of depression, anxiety, lack of social support. Now that's changing really, but in left ventricular assist devices, you may qualify for those, even marginal social support cases. But these are some of the key things that define if you could get a heart transplant or not, or you could be listed for a heart transplant or not. There are some nuances. Active cancer, if you are going to put an organ in someone, you are going to suppress the immune system, and if there's an active cancer, that will flare up. Active infection, so if you're really actively infected, that is something that you don't want happening. You want to be listing someone who's in septic shock, and then you immunosuppress them and everything falls apart. So really is fine. And then one of the big ones is something happens to the noodle, right? Your brain. So you have a hemorrhagic stroke or you've had a major stroke. Putting in a heart in someone in of that sort, you're not helping them. You're just going to add to their misery and quality of life. So we really want to make sure that there's no major catastrophic neurological issue that is ongoing. Once you have defined all of those, then you can potentially move forward. And some of these overlap with left ventricular assist device therapy as well. So I really think that it's a multifaceted decision. It's not just sometimes black and white.